Hi everyone, I'm Dr. Raj Prasad, Surgical Gastroenterologist, Omni Hospitals, Kukatpally. Hope everyone is safe and doing good at home. It's a difficult situation for all of us, everyone in this country and the world with this COVID 19. Most important is all of us stay at home and stay safe. But at this times, intriguing times, there are lots of times when we may be having a small issues which we may need to consult a doctor, but because of the present situation, it's difficult for us to come outside and consult anyone. So the most common cause of abdominal pain, like as all of us know, is gastritis or gastroenteritis. But now the gastroenteritis and gastritis, the incidence is a little low. One, because most of us are staying at home and hopefully eating healthy food, and most of us are eating homemade food. So the chances of infection or gastroenteritis levels a little less than what was compared to much earlier. And said that if at all you have a colicky abdominal pain, colicky is a spasmodic pain, that is a pain which is gripping in nature, which keeps coming and going intermittently, is not a continuous pain, or if you have some amount of vomiting or loose motions, it may be a cause of gastroenteritis or a viral hepatitis or viral gastroenteritis. So, in these situations, you may need to either consult a doctor or take some home remedies like drink lots of water, have food in time, and take a simple antispasmodic tablets which you can take at home and see if the pain settles down. Generally, most of the gastroenteritis or infections are self-limiting. Self-limiting, I mean, they come and they resolve by themselves in 2-3 days. If at all it doesn't settle in 2-3 days, or if the pain increases and you start having vomiting or increase in loose motions, which are causing dehydration. Dehydration is you become very dehydrated, your body fluids are less, you have a very high colored urine. In that situation, probably you need to consult a doctor or a nearest hospital, so that you'll have to get either rehydrated, or if you have vomiting, you need to get something for the vomiting. Because if you have vomiting associated with loose motions, it is difficult for you to take any medication, even an antiemetic or any medication which can reduce the diarrhea. And one thing which is very important is never take tablets over the counter for to stop the loose stools. Like some people take L-Dopa or loperamide for loose stools, which is not a very good thing, because L-Dopa or loperamide, they can cause a sudden cessation of stools, and if at all it is an infected cause of loose motions, then you will have an infection which will get accumulated in the intestines, and it may become a little more severe than what it is. The only best remedy is drink lots of liquids, take regular diet, preferably bland if you're comfortable, and lots of fluids so that you don't get dehydrated. If you have watery loose stools, a local remedy is to try to take sabudana or buttermilk, which can cause thickening of the stools. If at all you have vomiting associated with it, you can take over the counter antiemetic, which can be available at the closest pharmacy. And if the vomiting doesn't settle down, then you should meet the or visit the nearest hospital for further management. The present situation as COVID 19, earliest symptoms sometimes can only be an abdominal pain or diarrhea with loss of appetite. So, if at all you have diarrhea and loss of appetite along with some amount of nausea or vomiting associated with a little bit of breathlessness or fever or cough, then probably your symptoms may be related to a COVID 19 situation, where you may need to consult the specialized hospitals where the COVID 19 treatment or screening is done and get tested for that. So, because sometimes the only presentation of COVID 19 may be an abdominal pain or diarrhea. You may not even have symptoms of breathlessness or fever or cough. So, you can start off with a loose motion with some amount of anorexia. Anorexia is you have loss of appetite and a feeling like vomiting. And some patients can have anosmia, that means they have a difference in the change of smell. So sometimes what you regularly smell it, I mean, you may not be able to smell it. That also can be one of the signs of a COVID-19. It is still related to the GI symptoms, because smell is something which tells you about the different types of flavors of food. So keep in mind that if you have diarrhea, loose stools associated with breathlessness, it may be because of COVID. So if at all a situation like that arises, try to get yourself tested or visit a nearest hospital. And if at all you come as positive, make sure you follow the stay home, stay safe or a quarantine policy, which will be better for you and for your family members. The other common causes of abdominal pain during this situation, I'm going to only talk about common causes which can occur during this COVID because of the present situation. Constipation mainly because of eating low fiber diet, which can cause constipation, and this in return can cause symptoms like appendicitis or severe abdominal pain or spurious diarrhea in some patients. So it is very important that you hydrate yourself well, have good fiber diet. Good fiber diet, I mean, have good amount of green leafy vegetables, lots of vegetable curries, fruits. Fruits have to be eaten as a whole instead of having it like a juice. So when you take a whole fruit, you also take the fiber along with the goodness or the antioxidants of the fruit which they offer you. So always make sure you have whole fruit instead of having juices where you remove all the fiber. And along with your regular meals, there is nothing like you should not have non-vegetarian food or other types of food. You can have your regular diet, but make sure you have enough of fiber diet along with the regular diet that you take. Fiber diet includes green leafies and vegetables. And so, because constipation can cause fecal, they can cause the stools to get a little hard, and sometimes they can block at the entrance of the appendix and cause appendicitis. Is slightly more common during holidays and all that because lots of times people play, they run around, and then they don't take adequate amount of fluids, they get dehydrated, and then they have hard stools which can block the appendix and cause appendicitis. So appendicitis pain is a pain which occurs generally around the umbilicus initially. It is a continuous pain, and after some time, after some 4 to 5 hours or 6 hours, the pain settles down in the right lower part of the abdomen. So, if the pain which is starting in the umbilical region, but after some time the pain disappears from the umbilical region and the pain is located or localized to the right lower abdomen, associated with nausea or vomiting. Nausea is a feeling of vomiting sensation, and vomiting is when you actually throw out food or food particles, and decrease in appetite. Decrease in appetite is you don't feel hunger. So, these symptoms may suggest that you have something called appendicitis. Appendicitis, like in a colloquial or local thing, what we say is 24 hours pain, is the pain which occurs because of appendicitis. And if it is appendicitis, the pain is continuous pain, it is not intermittent, it doesn't come and go. You have a pain which is continuous in nature, and the pain can keep increasing with time, associated with vomiting or nausea and decrease in appetite or decrease in hunger. So these are the symptoms which will tell you that probably you have appendicitis. And if at all you have symptoms related to appendicitis, you need to visit a hospital where you can get a preliminary ultrasound of the abdomen, which can confirm it in most of the cases. Or if there is a doubtful diagnosis on ultrasound, or ultrasound is not able to pick up, a screening CT scan will confirm a diagnosis of appendicitis. The reason why I'm saying it is very important to confirm it is because even some part of colitis or viral gastroenteritis, you can have pain in the right lower abdomen or the right side of the abdomen, which may not be because of appendicitis. So a CT scan is more sensitive and specific in recognizing and diagnosing appendicitis and differentiating it from other causes of pain. Okay, the other causes of pain which can be or mimic appendicitis can be ruled out. So if appendicitis is ruled out, the other causes of pain can be treated by medications and you may not require a surgical procedure. This is summer season, it's very hot, dehydration is common. The chances of you forming small stones in your kidneys which can slip into the urinary pipe, which is called the ureter, can cause also pain. But this pain is generally starts off in the loin. Loin is the back of your just above the back of your abdomen, and the pain radiates. That means it's the type of pain which is colicky. That means it is a gripping type of pain. It comes towards the right groin, whichever side. If you have a stone which is stuck in the right side of the ureter, you can have pain on the right side, or if it's on the left side, you can have it on the left side. but it's a gripping type of pain which comes and goes. It's a spasmodic pain. It comes and goes. And along with this pain, you can have vomiting, and sometimes when the pain is there, it will be very difficult for you to find a position of comfort. So in some pain, what happens is when you have pain, you go into one position, either you fall, bend forward, or you lie down on the bed, or you turn to one side. The pain may have some relief. But in a ureteric colic, when the spasmodic pain comes, you will not find any comfortable position for your pain to settle down. So, if that situation occurs, you know that the pain is something related to a ureteric stone or a calculus, or a stone is a small stone. And these stones, you need to get investigated, because if the size of the stone is less than 5 mm, most of the time, 90% of the time, the stone itself gets passed away in the urine if you take lots of fluid. But if the stone size increases to 6, 7 mm, or the stone size is bigger, the bigger the size, the chances of the stone getting expelled by itself by just taking lots of fluid or hydration, the chances become less. So in these cases, it is good that you come to a hospital or the nearest diagnostic center to get an ultrasound done. So that if it is a ureteric stone or a calculus and the size is less than 5 mm, you can still take home remedy where you take lots of fluids, take antispasmodics, and just hope that the stone get passed away. But if the pain persists for more than 12 hours or 24 hours and you don't have any relief, then you need to visit closest hospital and meet a urologist for that. Gastritis is a very common thing, and all of us know about gastritis. It is a burning type of pain or sensation which occurs in the upper part of the abdomen in the center. And it is generally more when you're on empty stomach, and once you have a little bit of food or diet, the pain can reduce in intensity. So this is typical of gastritis, where you have pain with burning sensation, and once you take a little amount of food, you may have some relief. But in severe forms of gastritis, there may be lots of inflammation in the stomach, so even sometimes you'll not be able to tolerate food. So whenever you take some amount of food, you'll have a reflex vomiting because of the irritation which the food causes to the stomach. So in mild types of gastritis, making sure you have diet in time, or make sure you don't have a long gap between diet, making sure you don't stay late nights, because when you stay late nights either watching movies or spending time, you start getting more of acidity or gastritis. So if at all you are spending a lot of time in the night, staying awake a lot of time, make sure you drink some amount of fluid or eat some light diet or something in the night before you sleep, so that your gastritis symptoms can be reduced. And if at all you develop gastritis, make sure you have food in time. Try to take some curds or some buttermilk, and you can get PPI, that is protein pump inhibitors, which you can get over the counter, like pantoprazole or esomeprazole, which is readily available over the counter, and you can use it for a day or two. But if your symptoms don't settle down, or if you have severe vomiting, you need to visit your closest clinic or a hospital for further management. Because sometimes gastritis can go to a level where it can increase, and then you can have ulcer formation, which can be there for a longer period of time than what is expected. Another cause of pain can be a duodenal ulcer, which is also called a part of the acid peptic disease, where the pain reduces when you take some amount of food, and the pain is generally more in the late night or early mornings, around 12 to 1, when you're on empty stomach, and the pain is relieved when you take food. So that can be because of a duodenal ulcer. But at this present situation, most of the places endoscopy is done only for emergency purposes. So getting diagnosed for a simple gastritis or for a duodenal ulcer or any acid peptic disease which can be managed by medication, it's better to get managed by medication now, because doing an endoscopy is at a higher risk for person who's doing it and for the person who's getting it to get infected, if at all there's anyone who's infected already by a COVID-19. Pancreatitis is an infection which occurs to the pancreas. Pancreas is an organ which generally controls the digestion. It produces juices to control the digestion, and it produces hormones to control your sugars. So when you have pancreatitis, which can occur either because of too much intake of alcohol, which sometimes it may be a cause because most of the people are free, you like to party or you like to have something. But some people, the alcohol can aggravate a pancreatic inflammation, which is called pancreatitis. So some people may not tolerate alcohol like everyone do, and that is one of the most common causes of pancreatitis. There are also other causes of pancreatitis, like sometimes you have gallstones, a gallstone or a stone in the gallbladder, which can slip and cause pancreatitis, called gallstone pancreatitis. Or some medication can cause pancreatitis, or sometimes you may not have any reason to develop pancreatitis. But said that the most common cause of pancreatitis is alcohol, and the pain because of pancreatitis is generally which occurs in front of the abdomen. You have a continuous type of pain, and you have the pain which radiates to the back, exactly wherever you get in the center of the abdomen, in the upper abdomen. The pain goes back to the spine. So this is called radiation of pain. So when you have a pain which is in the center of the abdomen, which goes back to the back, then at the same time, see the difference between the pain of appendicitis, you have pain of the umbilicus, and then when you have pain in the right lower abdomen, the pain of the umbilicus disappears. That is called referred pain, or you have a pain which comes in another area. This is radiating pain, is you have pain in front of the abdomen, at the same time you have pain at the back. So when you have that, then probably you have something called pancreatitis. And in pancreatitis, it is better that you visit the hospital, because you will generally have vomiting, which will be non-bilious. That means there will be not green in color, but whatever you eat, and the pain can be quite severe. And pancreatitis, depending upon whether it is mild, moderate, or severe type of pancreatitis, you can have a mild pain which can settle in a day or two, or moderate to severe, you may need to get hospitalized, and the pain may be there for almost a month or 2 months with associated complications, which can be severe in a few of the patients, which will increase the morbidity or prolonged stay in the hospital. So, if at all you have suspicion of pancreatitis or pain, which I am telling you about, pain in the epigastrium or in the upper part of the abdomen, which is radiating or present at the back also at the same time, then please visit a hospital, get a simple amylase lipase investigation, which are very sensitive for pancreatitis, diagnosing pancreatitis. And if the values are elevated, then probably what you have is pancreatitis. And if at all this pancreatitis, the physician or the ER doctor, whoever is there, may suggest you to get additional investigation to see or to confirm pancreatitis, like an ultrasound or a CT scan, or a few blood investigations to see whether the severity of pancreatitis is mild, moderate, or severe. So if the pancreatitis severity is moderate or severe or even mild in some cases, you may need to get admitted for observation and followed up over the next 24 to 48 to 72 hours to see if the progress of the disease is on the positive side and improving clinically, or you have symptoms which are either increasing, or you have a pancreatitis which is of severe in condition, which needs additional care or additional stay for you to stay in the hospital. So pancreatitis should not be taken very lightly, because most of the time, I mean, they do recover well, but a few patients who have severe pancreatitis may need to be in the ICU, may go on ventilator, or the morbidity can be quite high. So it is not something which has to be taken lightly. And those patients who already have an history of pancreatitis earlier, it is better that you avoid alcohol or other things which can cause pancreatitis to you. So be a little careful. I mean, and I think you have to be very careful about what choices we make, especially since you're free. Some people may think, I mean, it is okay even if I had some problem with alcohol earlier, it may not occur again. So please be very careful, because at these times when the hospital or the hospital services also are limited, you may have difficulty in getting the right place to go to when you have any issues. So please be careful and try to avoid things which can be avoided or which can prevent you from getting some issues. But once this is posted, if you do have any queries, please send in your queries. So we'll try to reply back to you as soon as possible. Or if there's any issues, I mean, Omni hospitals, we are open for elective procedures and elective OPDs starting this week. And we are following all the COVID-19 precautionary measures like social distancing, making sure we are using masks and sanitizers. And all the patients who need to get admitted for any purpose are getting a COVID panel done, where you're investigating and seeing whether there's any signs of corona or COVID positive, and only then we are operating. Said that, I mean, there may be lots of times when we can miss out. So unless otherwise it is really necessary for you to come out and visit a hospital, try to stay home and stay safe. Thank you.